This is a quick introduction to creating an evidence table. The purpose of evidence tables are to incorporate multiple pieces of evidence into a single table. We want to be able to examine the underlying similarities or differences to illustrate trends in the data and support or guide our next steps that are associated with our clinical practice question or our research question. Also, properly constructed evidence tables, they effectively and efficiently convey the results. It also presents the literature in an organized fashion, so whoever is reading it can go through it very quickly. Before we get started, there's three concepts you need to keep in mind: validity, reliability, and applicability. So there's a question associated with each one of these. Are the results of the study valid? So in other words, are the results as close to the truth as possible, and were the best possible research methods utilized? What were the results? So with quantitative, did the intervention work? How large was the treatment effect? Can researchers conduct the same study and expect similar results? With qualitative, we want to look at if the research approach fit the purpose of the study. And lastly, will the results help me with patient care? In other words, are the benefits greater than the risk? Is it feasible to implement this finding into practice or into the organizational structure? And does the patient desire these treatments? Okay, these are components of a fairly standard evidence table. And in this one that we are presenting, the blue font refers to research, the green non-research, and the black is all evidence. And along here are little prompts as to what to put in. The caveats about a research table is, of course, you want to use one table for all your studies, because this allows you to compare and contrast that data. Parsimony, or being succinct and clear, is critical. Don't use complete sentences in any column except for maybe some of your own notes. Use abbreviations and be consistent with those, because it will help the readers as they go through your table. Always keep your desired outcome in mind, your clinical practice question or your research question, and only put relevant data or information into that table. And remember the three things that we're looking for, which is validity, reliability, and applicability. So as we go through this table, first you're going to see the author's publication and title always go into the first column. Just last names, the date, and the title. It's always nice to include a DOI if you can, because the readers can then link out to a piece of evidence should they desire. The purpose is what's next. So if you want, with research, you can place the hypotheses or the aims of the study. With a QI project, for example, you can put in the PICOT question. So the study design and methodology, it's really important to clearly list what that is. Is it a randomized control study? Is it a qualitative grounded theory approach study? Or is it a clinical practice guideline, etc.? Very important to address. Sample size and sample setting. What is your number? What are the population characteristics? So your N, and maybe it's just pediatrics, or maybe it's just persons with diabetes that you're looking at. The sample setting is important because was it a single site hospital maybe, or was it a study that took in many hospitals, if we're looking at something in acute care across the nation? And with literature reviews, the prompts are, did they list the designs of the articles? Did they identify the types of articles that they are utilizing? What types of databases did they use? How many, really? Next is the major variables and definitions. So just something to remember as we're looking at the IV, independent variable, and the dependent variable. And independent variables, sometimes when you read through the literature, they can be called explanatory, predictor, or covariates, but that is the independent variable. And remember, those are the ones that are being controlled or manipulated by the researcher. And for example, like a treatment or a program intervention. The dependent variable is oftentimes called the outcome variable, and that is what is affected by the independent variable. And then as you see here, here's some prompts for some of the non-research literature or evidence. The measurements of the variables, all that is the scale, instrument, or tool. They're all synonymous. What was utilized to measure the variables? Data analysis. Data analysis is just a list when we're talking about qualitative or quantitative research of what they found. For example, and it's easier, just pretty much this applies as we go back to quantitative data. What were the statistics utilized, period, just a list. And if we want to look at non-research literature, we can talk about guidelines, for example. Were they reviewed and tested? And next is the study findings. And whatever you list here, especially when you're talking about the quantitative, whatever you listed here as a test, like ANOVA, for example, then make sure you list what they found in that statistical analysis in the study findings area. And qualitative data, I don't want to leave that out too. But if someone, as they go through the data analysis and they were what we call coding or things like that, you would address those, that type of analysis also in the study findings. Very important with quantitative to always address the effect size and then the P as well, significance or not significant. So the strength of evidence and the quality of evidence is very important. The higher the evidence or the higher the strength, or the more strength in the evidence, one should say, the more solid that evidence is. For example, utilizing randomized compared trials compared to maybe a descriptive quantitative research study. And then, of course, the quality of the evidence. It doesn't matter in the end what you use to measure the strength of evidence and the quality of evidence. We like to use the Johns Hopkins evidence rating tool here, but AACN has one, and there are others utilized as well. But no matter what, you choose one and you stay consistent, and it's always good to put it at the end of the evidence table so your readers know exactly how you are rating the evidence. And then lastly is the appraisal of worth. Is it feasible, in other words, to your clinical practice or to the organization? What are the strengths and the limitations of this study? What are your conclusions or your recommendations now since you have synthesized this literature? So you've gone through and you've synthesized the literature. How do you feel with this regarding this evidence? Something to remember is if the evidence is strong, there's good strength and quality, and the evidence is present, then if you were trying to look at an evidence-based practice change, this is your go-ahead to make that practice change because the evidence is there. It's solid and it's good. If you go through and your evidence is very poor, not of high quality, or it doesn't exist, then you know you need to definitely talk to the researchers and move into the research realm. Now, all of this may sound a little bit hard, but as we go through and we place, we take a quantitative study and we put it into the evidence table, we'll go through and we'll make sure we address each one of these so they're much more understandable. All right, thank you.